There's a burnout epidemic. Let's get down into it. And why is it happening? In today's world, people are way more stressed than they ever have been. People who look great on the outside, high performers, growing their business, think like they have everything, but really deep down, they are struggling. They're having issues with word finding, concentration. They're exhausted all the time. They're doing everything right, eating right, exercising, taking supplements, yet they still feel burned out and having all these issues with concentration and mood and whatnot. So let's talk about that. Basically, burnout or overwhelm really affects our dorsolateral medial prefrontal cortex. So that's a fun, long word for essentially the area of the brain that has to do with emotional regulation and cognition. And when we're in overwhelm and burnout, all of a sudden, instead of being able to prioritize your lists and knock things off and kind of do them in order of priority, everything seems to be high priority and everything feels too much. And it's part of the neurobiology that happens in chronic stress. That area of the brain is kind of overworked, and then, we have emotional dysregulation, and then our concentration's off, our sleep can be off. Up until now, options for burnout. And again, patients may not understand or appreciate that it's truly burnout. They might feel depressed. They might come in with insomnia. So they may go see their doctor. And often, doctors don't have a lot of time. And often they'll go, here's a sleeping pill, here's an antidepressant, here's an anti-anxiety medication. And often a lot of those things may come with side effects and some, especially sexual side effects, and that they also can blunt mood and also affect our concentration. Actually, now we have a solution that is drug-free, minimal to no side effects, no sexual dysfunction. If anything, it probably improves things, can improve your pain, improve your sleep, improve your weight management. And really, there's an amazing treatment out there called Exomind that will actually work on that part of the brain, increase new connectivity, neurons, downregulate that part of the brain so it's not overreactive, and the results are amazing. It's great for everybody, amazing for those high-performing people like the athletes, the CEOs of business, but anybody, perimenopause, menopause women. Why? So it's basically regenerative, helps with anxiety, OCD, binge eat, it improves sleep, it works on the sleep-wake cycle, it helps with emotional eating. Who wouldn't benefit from a treatment? And often we recommend a series of 6 or 12 to get you back to yourself and even be better than yourself. Patients often ask, what does it feel like to get Exomind? And basically, I have to say it's a very calming treatment. You come in, you lie down. It's often in a quiet room with low, soft music playing, and we apply the applicator on your head. Most of the patients will often fall asleep. You might feel a very light tapping. People talk about it's very soothing. Often people wake up after doing a treatment and feeling very refreshed and regenerated, saying they had the best nap of their life. Often side effects might be usually on the first couple of treatments, so that might be mild headache or fatigue. And it's no different than if you had an intense workout at the gym that you might feel tired afterwards. And so you just worked out your brain. You need to come very hydrated. When you work out your brain, you use a lot of glucose, so make sure you eat before coming. But otherwise, that's about it. Again, burnout, overwhelm is very common. And, a lot of people think they can fix it themselves, especially if you're that type A high performer, don't like asking for help. And this is an area that's important to address, because if you chronically feel this way, you're actually causing more degeneration in your nerves, and it's only going to get worse as we're always aging and we're always exposed to toxins and other life events that really push us over the edge. And I personally have done Exomind, and I don't really have, I'm going to say anxiety or depression, but I definitely go through periods of burnout or feeling overwhelmed because so much goes on in my life. And I've done my Exomind, and after I do a series of 6, I can tell you I feel way more more resilient, my concentration's better, my sleep is like the best ever in my life. And when you sleep well, you restore better. Also, I've noticed my appetite's not as large. So sometimes just like, going to the gym and working out, like, you want to do your initial series, but you may also want to think about ongoing treatments every once in a while, because why? We're always bombarded by stress and we're always aging. That's all inevitable, but using the technology can help us cope better and actually turn back the clock and help us be better versions of ourselves. I hope you found this conversation very helpful. If you like what you heard, like us, comment, and better yet, give us a call or book an appointment.